Hi, I'm Dr. Kennard. I am a family medicine physician. I have experience working in the emergency room as well as in the primary care setting. I am working with Advance in Medicine to bring you a series of presentations on how to read scientific papers. Now, recently, with current events, there have been many articles that have come out about the coronavirus and the pandemic, and there has been such a vast amount of information that we have been exposed to that sometimes it's hard to determine what is a quality article and how do I read the literature in a way that is efficient but also helpful for whatever it is I need, whether it's my clinical practice or whether it's personal research or developing policies or public health procedures. And so I want to present a series of presentations that will help you understand the medical literature and also evaluate whether it is significant for you or for changing clinical practice in general. This first presentation of how to read a journal article will cover the types of articles you might find in the literature, but also at the very end we'll talk about what's the definition of a quality article and how would you go about determining whether an article is of quality. Most of the information is adapted from an article titled Art of Reading a Journal Article Methodically and Effectively that was published in the Journal of Oral and Maxillofacial Pathology in April 2013. When you search the literature, you'll find two types of journal articles, those which qualify as primary literature and those which qualify as secondary literature. Primary literature is basically an author's original research or original thoughts, and secondary literature is when an author takes resources from the primary literature and reviews it, summarizes it, or analyzes it. And we'll be talking about just a few from each of these categories today. First, I want to define a few types of primary literature: original research articles, case report and case series, and editorials, and give you a couple of examples of each. So original research articles are decently self-explanatory. It is the original research done by researchers. And these include randomized controlled trials, controlled clinical trials, experiments, surveys, case control, or cohort studies. We're going to go more into detail on these later in the series in order to define each one and help you understand exactly what is involved in each of these types of original research articles. Case reports and case series are descriptions of cases that a medical center or a physician or medical care provider has seen, and they describe when a clinician sees a rare disease or they see an unusual presentation of a well-known condition. And a case study is different from a case series in that case studies are just a report of a single clinical case, one patient, and a case series is a description of several cases. And so on the right, you can see an example of a case series, and it's large vessel stroke as a presenting feature of COVID-19 in the young. So what happened is a medical center started seeing patients presenting with stroke who are young, who were otherwise not at risk for stroke, and these patients also had COVID-19, so they started asking themselves, is this a presenting feature of COVID-19, and decided to write up a report to put it into the literature. And these are very important for the medical literature because if you start seeing several case series or case studies that are similar, then you may learn something new about a disease or discover a new disease altogether. And they're also helpful for personal practice. As you read these in journal articles, you may have patients come present to you with similar symptoms as something that you've read already in a case study or a case series. And this will help you broaden your differential diagnosis and recognize when you have a rare presentation or something new
that comes into your office or clinic or hospital.
Editorials are another type of article you might find in the primary literature. And as you can see here, it can be a perspective about articles published in a particular issue of a journal, meaning someone writes a summary or gives comments on articles that present in one edition of a journal. And it's usually persuasive. It's usually arguing a specific point of view. It's usually written by the editor of the journal, a senior staff member, or an outside expert on the topic. And I go over this because it's important to remember that editorials are not scientific articles. They're not scientific papers. They're not original research. They are merely someone's opinion or summary about a certain body of research. And they're helpful because they pull together different types of articles. They pull together the information and put it in a nice summary. But anytime someone is trying to argue for a specific point of view based on qualitative arguments or qualitative data, you have to take it as just that. And you may not want to choose these types of articles to completely inform your opinion, but it can help to give you one side or one perspective. And oftentimes these editorials will summarize articles or give a perspective on research, and they address often the problems in this research, or they pose questions about new problems. Or they'll give food for thought, which is an expression that means it gives you information to help you maybe think outside of the box and to think further about what other information needs to be researched in order to have a good whole view of an issue or a topic. Now we're going to take a look at a few examples of secondary literature. And just because it has the name secondary does not mean it is not important. In fact, these are very important sources to go to when we are looking for information, medical or scientific information. The first we'll cover is a narrative or literature review, then a systematic review, and a meta-analysis so that we can understand the difference. A literature review, there's several names for it. Another name is a narrative review, and it's an article that reviews the literature on a given topic and gives a broad qualitative overview of that topic. There's no specific question being answered and no hypothesis stated. So for example, we have an article here to the right. You can see it's titled Coronavirus Disease 2019, a literature review. And so basically someone goes through all of the literature and presents a topic in a thorough manner, but just presents. It just gives a broad overview. So for example, in this article, I believe it goes through the history. When did it start? How did coronavirus start? What is the epidemiology? How did it spread across the world? How many people have died from it up to this, the writing of this article? It goes through the known pathogenesis, the known pathology of the disease, and then it describes current treatments, diagnosis. So it's really just an overview of a topic. And this could also be, for example, if you wanted to do a literature review of For example, a very broad topic would be neuropathy and diabetes. You would just basically describe what we know about it and the basics of what you would want to know as a medical care provider, including the epidemiology, the diagnosis, the treatment. So this is not a research article, except for the fact that you review all of the literature to create a summary. A systematic review differs greatly. What a systematic review does is it collects all possible studies or original research articles, those randomized controlled trials, all of the ones listed under original research articles. It collects these studies related to a given topic, and then it reviews and analyzes the results. It puts them all together and tries to come up with a summary of the results with a scientific mathematical analysis. It does ask a specific topic. It does ask a specific question about a topic. And so you can see the article to the right, the title is A Systematic Review on the Efficacy and Safety of Chloroquine for the Treatment of COVID-19. So it's specifically addressing whether chloroquine is effective and safe for the treatment of COVID-19. So it's asking a very specific question. And then it gathers all of the known studies, all the possible studies that meet a certain criteria, and it puts them together to try to see what is the overall result of all of these studies combined on the efficacy and safety of chloroquine for the treatment of COVID-19. It also details, to be a systematic review, it must detail, meaning it must list out or describe the methods that the authors used to identify papers in the literature. So that helps you know what were they using as criteria to include an article in this review. It also uses predetermined criteria, as I mentioned, for selecting which papers are used in the review. And so the authors will decide it must be a randomized controlled double-blinded study. It must have looked at these variables, A, B, and C. And so they'll create criteria to select which papers they want to use. It also evaluates the quality of evidence in the papers using a grading tool, and there are several which can be used, and I will go through some of those for those of you who want to possibly conduct a systematic review yourself in the future. But for the purposes of this presentation, the grading tools are used to help the authors know if the quality of evidence is enough to be included in their systematic review. And it also, most importantly, analyzes the data qualitatively or quantitatively. And this is important to understand, to know the difference between a systematic review and a meta-analysis. A systematic review is allowed, by definition, to analyze data qualitatively, meaning it does not have to combine all the numbers to create one number or one result. It can just evaluate and say a general statement such as, based on our review of all of these articles, chloroquine for the treatment of COVID-19 is effective and safe. And so it doesn't have to give you a number necessarily, maybe more of a chart of numbers from the articles that they used for the review, but not one combined number or statistic. A meta-analysis and systematic review can often be confused because many systematic reviews also include meta-analyses. But meta-analyses are simply a statistical method to combine the data of separate studies. It's a way to objectively and quantitatively evaluate the outcome of a specific research question. So it's similar with a systematic review in that it does answer a specific question about a specific topic, and is often included in the systematic reviews, but it uses statistical tools and analyses to come up with one result. And this is the highest level of evidence. And so, like with systematic reviews, the authors must define how they chose different research articles and different studies. And then the studies have to be similar enough to where they can statistically combine the results. We're going to talk more about statistical analyses later. But for example, if one study reported their results in odds ratio and another study reported the results in relative risk, the authors of a meta-analysis must use tools to help combine that into one number. So for example, the authors may choose to report all results in relative risk. And so this is a way to quantitatively, objectively give the readers a numerical result rather than having the readers look through the results of every single article or study included in the review. So how do you find a quality article? First, you really must know why you're reading. Are you reading to inform your own research? Are you reading to change clinical practice? Are you reading to help develop public health or governmental policies? So know what you want to know and why you want to know it. And then you really have to know how to read the selected article methodically and efficiently. And I'll go much more into detail with that in part 2 of reading a journal article. But here is a simple flow diagram, very basic, but I think it's worth going through. Is the title related to the topic that I'm looking for, and does it have keywords, which I have in mind? This seems obvious, but it's important to not get entrenched in articles that are irrelevant so as not to waste your time. If the title is not what you're looking for, go to the next article. If it is, then read the abstract, which usually is at the beginning of the written article, and then the summary and conclusion. Can you tell if the article has clear-cut aims and objectives? Do they have a well-defined hypothesis? And are the conclusions precise enough to be helpful? And is all of this information, is it useful or relevant to what I'm looking for? If yes, go ahead and read the entire article. To find a quality article, you must also consider the quality of evidence. So in this pyramid, at the very bottom is in vitro research. It's the biggest box because there's a lot of it. Researchers are working in limited settings with a limited number of subjects or a limited information, but it has to happen in order to inform the other types of research. And then you have animal research, ideas, editorials, opinions, case reports, case series. Case series are a higher quality of evidence simply because there are more patients involved in the report. And then you have case-controlled studies, cohort studies, randomized controlled double-blind tests, and systematic reviews and meta-analyses, which are at the tip-top of our pyramid because they include much of the other research and put them all together into one place. It's also important to understand that an article published in a peer-reviewed journal is more valued than one which is not. And the reason is peer-reviewed journals have experts in the field on a certain topic evaluate the articles that will be published in that journal before they are officially published. And these outside experts can look at a study and identify maybe some biases that weren't previously identified. and they can determine whether the research was done well and whether this article is worthy to be published in this journal. They can give feedback to the authors, who can then go and evaluate their research and modify how they put together their article before it's actually published. And the more input that you have, the more outside views that you have, will eliminate more bias and will make the article of higher quality. That is all for this presentation. In the next presentation, part 2 of reading a journal article, we're going to go more into detail about how to read an article methodically and efficiently, and define the parts of a scientific paper and why each part is useful.